When Dr. Marcus Williams walked into his own medical clinic wearing ordinary clothes, he had no idea that his basic insurance card would mark him as unworthy of the life-saving care he had spent 25 years fighting to provide to others. What started as a routine physical became a nightmare of medical discrimination so shocking that it would expose a two-tier healthcare system operating in the very institution he built to honor his mother's memory. Watch as a brilliant physician is denied preventive cardiac screening in his own clinic simply because he doesn't look wealthy enough to deserve comprehensive care, while well-dressed patients receive VIP treatment just steps away. But when this uninsured patient reveals his true identity as the CEO and founder of the entire medical empire, the staff who discriminated against him will face consequences that will change healthcare forever. This isn't just a story about one man's fight for dignity. It's about the life and death reality that your appearance and insurance card can determine whether you receive healing or harm in America's medical system. Stay until the end to see how one CEO's undercover mission transforms not just his own organization, but creates a blueprint for ensuring that healthcare becomes what it was always meant to be, a human right that saves lives without judging the worth of the person seeking care. Dr. Marcus Williams stood in the mirror of his penthouse bathroom, deliberately choosing the most ordinary clothes in his wardrobe. Knowing that in just 2 hours he would walk into his own medical clinic and experience firsthand whether the empire he built on compassion had become corrupted by greed. The irony wasn't lost on him that the man who owned 15 premium healthcare clinics across 3 states was about to test whether his own staff would treat him with basic human dignity simply because he looked like he couldn't afford their services. At 48, Marcus had seen enough of America's healthcare system to know that your insurance card often mattered more than your pulse. Growing up in Detroit's East Side, he had watched his mother, Dorothy Williams, die from diabetes complications not because the disease was untreatable, but because she couldn't afford the insulin that cost more than their monthly rent. She died in their cramped apartment at age 42, holding his hand and whispering, "Promise me you'll make sure this doesn't happen to other mothers." That promise had driven every decision he'd made for the past 25 years. The Williams Medical Group wasn't just another healthcare business. It was Marcus's answer to a broken system that treated medicine like a luxury instead of a human right. Each of his 15 clinics operated under the motto, "Healthcare without barriers." Though few people knew about the secret program that provided free, comprehensive care to uninsured patients, quietly funded by the premium services offered to wealthy clients. Marcus had designed a Robin Hood system where the rich unknowingly subsidized life-saving care for the poor, and it had worked beautifully for over a decade. But recently, disturbing reports had been filtering back to corporate headquarters. Patients complained about rushed appointments, dismissive staff, and being told that certain services weren't appropriate for their insurance level. The complaints weren't loud enough to make headlines, but they were consistent enough to make Marcus's stomach turn. Had his dream of equitable healthcare become just another business where profit trumped patients? Today's test was personal. Marcus had scheduled a routine annual physical at his newest flagship location, the Prestige Health Center, under his employee insurance plan rather than his executive coverage. He deliberately chose clothes that would make him invisible to the kind of staff who judge patients by their appearance. Faded jeans, a basic polo shirt from Target, and sneakers that had seen better days. No Rolex, no designer anything, just a middle-aged black man who looked like he worked construction rather than owned a medical empire. The plan was simple yet terrifying. walk into his own clinic as an ordinary patient and see if the staff would uphold the values he'd spent his life fighting for, or if they'd reveal the ugly truth that even in his own organization, healthcare had become a privilege reserved for those who looked like they could afford it. As Marcus grabbed his basic insurance card and headed for the door, he couldn't shake the feeling that he was about to discover whether his mother's sacrifice had meant anything at all, or if the very system he'd built to honor her memory had become part of the problem she died fighting against. Have you ever been judged in a place where you deserved respect? Have you ever felt invisible when you needed care the most? Marcus's story is about to reveal a truth that affects millions of us every single day. If you believe that healthcare is a human right, not a privilege based on how much money you appear to have, hit that like button right now. Share this story with someone who needs to hear that their dignity matters, regardless of their insurance card or the clothes they wear. Subscribe and ring that notification bell, because Marcus is about to walk into a situation that will change everything he thought he knew about his own company, and what happens next will restore your faith that sometimes justice does prevail. Drop a comment telling us about a time when you were treated unfairly in a healthcare setting, because your voice matters, and together we can demand better for everyone who walks through those clinic doors seeking nothing more than the care they deserve as human beings.
Right at that moment, Marcus stepped through the gleaming glass doors of Prestige Health Center. He felt the familiar weight of his mother's memory pressing against his chest. But nothing could have prepared him for what he was about to witness in the very place he had designed to honor her legacy. The marble floors reflected the afternoon sunlight streaming through floor-to-ceiling windows, creating an atmosphere of clinical luxury that whispered expensive care to anyone who entered. Crystal chandeliers hung above leather seating areas, where well-dressed patients sipped complimentary sparkling water from crystal glasses, their designer handbags and tailored suits marking them as the kind of clientele this flagship location was clearly designed to attract. Marcus approached the reception desk where Stephanie Chen sat behind a computer screen, her perfectly manicured nails clicking against the keyboard with practiced efficiency. She was handling the check-in process for a distinguished gentleman in a $1,000 suit, her voice warm and accommodating as she said, "Of course, Mr. Patterson, we'll have you in the executive suite within 5 minutes. Can I offer you some refreshments while you wait?" The contrast was immediate and jarring when she finally glanced up at Marcus with the kind of expression reserved for interruptions rather than patience. "Can I help you?" Stephanie's tone had shifted from honey to ice water in the span of 3 seconds. Her eyes quickly scanning Marcus from his faded jeans to his worn sneakers before settling on his face with barely concealed skepticism. When Marcus explained he had a 2 o'clock appointment for his annual physical, Stephanie's fingers hesitated over the keyboard as if she was surprised to find his name in the system at all. "I'll need to see your insurance information first," she said, extending her hand with the kind of impatience that suggested she expected this to be a short conversation. Marcus handed over his basic employee insurance card, watching as Stephanie's expression shifted from skepticism to something approaching disdain. She held the card between 2 fingers as if it might contaminate her perfectly polished nails, studying it with the intensity of someone examining evidence of a crime. "This is minimal coverage," she said, her voice loud enough for nearby patients to hear. "Are you sure you can afford our services here? We're a premium facility, and our costs reflect that level of care." The words hit Marcus like a physical blow, not because they hurt his feelings, but because they revealed the cancer that had been growing in his organization. Behind Stephanie, he could see Nurse Patricia Nils emerging from the back office, her eyes immediately assessing his appearance with a kind of professional judgment that had nothing to do with medical care and everything to do with financial profiling.
The two women exchanged a glance that spoke volumes about the unwritten protocols they had developed for handling patients who didn't meet their visual standards of wealth. As Marcus watched Mr. Patterson being escorted to what was clearly the VIP section of the clinic, offered a menu of premium services, and treated like visiting royalty, he realized that his worst fears were about to be confirmed. The empire he had built to eliminate healthcare discrimination had somehow become a monument to it. And he was about to experience firsthand just how far his own staff had strayed from the mission that had cost his mother her life. But the tragedy had not stopped yet, and what Marcus experienced over the next 45 minutes would shatter every belief he held about the organization he had poured his heart into building. While Mr. Patterson and 3 other well-dressed patients who arrived after Marcus were called back for their appointments, Marcus remained in the waiting area, watching the systematic inequality unfold before his eyes like a carefully choreographed dance of discrimination. Each time the door to the treatment area opened, it was for someone who looked like they belonged in a country club, not for the man in faded jeans whose insurance card had marked him as unworthy of prompt attention. When Nurse Patricia Mills finally called his name, her tone carried the enthusiasm of someone announcing a dental procedure rather than welcoming a patient seeking preventive care. She led him not to one of the spacious executive suites he had glimpsed through open doorways, but to the smallest examination room in the facility, a cramped space that felt more like a storage closet than a place where life-changing medical decisions were made. The contrast was so stark that Marcus wondered if this room was normally used for patients at all, or if it was reserved specifically for those deemed unworthy of the premium experience his clinic promised to provide. Patricia's intake process was a masterclass in medical negligence disguised as efficiency. She rushed through the standard questions with the speed of someone trying to catch a train, barely waiting for Marcus to finish his answers before moving to the next item on her checklist. When Marcus mentioned his family history of heart disease and asked about preventive cardiac screening, Patricia's pen stopped moving entirely. "That's expensive testing," she said, her voice taking on the tone of a parent explaining to a child why they couldn't have candy. "Maybe you should try the community health center downtown. They have programs for people in your situation." The phrase "people in your situation" hung in the air like toxic smoke, and Marcus felt his mother's spirit stirring within him as he realized that Patricia had just reduced him to a stereotype based entirely on his appearance and insurance card. This was exactly the kind of dismissive treatment that had killed Dorothy Williams, the assumption that certain people didn't deserve comprehensive care simply because they didn't look wealthy enough to afford it. The irony was devastating. He was being discriminated against in a system he had specifically designed to prevent this exact scenario. Then Dr. Jennifer Hartwell entered the room without knocking, her white coat pristine and her expression already set in the kind of professional mask that said she had better places to be. She glanced at Marcus's chart with the same enthusiasm someone might show for cleaning a bathroom, her eyes quickly scanning the insurance information before settling on Marcus with barely concealed impatience. "Basic coverage," she muttered, as if diagnosing a terminal condition. "Well, let's see what we can do within your limitations." The word limitations dripped with condescension, transforming what should have been a collaborative healthcare discussion into a negotiation about what Marcus deserved based on his perceived social status. What happened next would prove that the discrimination wasn't accidental, but systematic, deliberate, and so deeply embedded in his clinic's culture that it had become standard operating procedure. What happened next would prove that the discrimination wasn't accidental, but systematic, deliberate, and so deeply embedded in his clinic's culture that it had become standard operating procedure. Dr. Hartwell's examination was a mockery of everything Marcus had learned in medical school about thorough patient care.
She performed a perfunctory check of his blood pressure, listened to his heart for less than 30 seconds, and skipped entirely the comprehensive review of systems that should have been standard for any annual physical. When Marcus asked about the blood work that was clearly covered by his insurance plan, Dr. Hartwell barely looked up from her clipboard. "Those tests are quite extensive," she said, her tone suggesting that Marcus was asking for something unreasonable rather than basic preventive care. "I'm not sure they're necessary for someone in your demographic." The phrase "your demographic" landed like a slap across Marcus's face, revealing the ugly truth that his own physician was making medical decisions based on racial and socioeconomic profiling rather than clinical judgment. This wasn't medicine, this was medical apartheid happening in real time. And Marcus was experiencing it in the clinic he had built to eliminate exactly this kind of discrimination. The breaking point came when Marcus heard voices through the thin examination room wall and realized that Dr. Hartwell was treating her next patient with a completely different standard of care. "Mr. Richardson, it's wonderful to see you again." Her voice was warm, engaged, professional, in a way it had never been with Marcus. "Let's do the full executive health panel today. We'll run comprehensive cardiac screening, advanced cancer markers, metabolic analysis, the works. I want to make sure we catch anything early." The contrast was so stark that Marcus wondered if he was listening to the same physician who had just dismissed his request for basic preventive testing. When Dr. Hartwell returned to his room 8 minutes later, she handed him a prescription for generic vitamins and what appeared to be a pre-printed discharge summary. "Here's something basic for your general health," she said, already moving toward the door. "You can fill this at any pharmacy. We'll see you next year." There was no discussion of his family medical history, no preventive care plan, no follow-up recommendations. Marcus was being medically abandoned in his own clinic, treated like a burden rather than a patient whose life had value worth protecting. The final insult came when a well-dressed white patient arrived claiming a minor emergency, and Dr. Hartwell immediately accommodated him, while Marcus was forced to wait an additional 30 minutes. Through the walls, he could hear her offering concierge services, house calls, and direct phone access to the very patient who had interrupted his already abbreviated appointment. The message was clear. In this clinic, your skin color and your clothes determine whether you receive life-saving care or life-threatening neglect. As Marcus said in that cramped examination room, quietly recording the discrimination on his phone, he realized that his mother hadn't just died from diabetes. She had died from the same medical racism he was experiencing right now. And somehow, despite all his efforts, he had allowed that same deadly bias to infect the very organization he had built to honor her memory. If this story breaks your heart the way it should, hit that like button and share it with everyone who needs to understand that medical discrimination isn't just unfair, it's literally killing people. Subscribe and tell us in the comments about a time when you or someone you love was treated differently in a healthcare setting, because your voice matters, and together we can demand better. What Marcus does next will change everything.
No one expected what happened next, but Marcus Williams had reached the moment where silence would be complicity in his own mother's betrayal, and he was about to turn the tables on a system that had forgotten its most sacred duty. As he stepped outside the clinic into the cool afternoon air, Marcus felt the weight of 25 years of fighting for healthcare equality pressing down on his shoulders like a lead blanket. The irony was so bitter he could taste it. The man who had dedicated his life to ensuring that no one would die like his mother had just been medically abandoned in his own building, treated like his life didn't matter simply because he didn't look wealthy enough to deserve comprehensive care. Marcus pulled out his phone with hands that were steadier than they had any right to be, considering that his entire life's work had just crumbled around him in the span of an hour. He scrolled to Dr. Sarah Rodriguez, his chief medical officer, a woman who had stood beside him through every challenge, every expansion, every late-night strategy session about how to make healthcare truly equitable. When she answered on the second ring, her voice was warm and familiar, a stark contrast to the cold indifference he had just experienced inside his own building. "Sarah," Marcus said, his voice carrying the quiet authority that had built a medical empire. "Initiate Code Red review at Prestige location. We have a systemic problem that goes to the core of everything we've built." There was a moment of silence on the other end, and Marcus could almost hear Sarah's brilliant mind shifting into crisis mode, understanding that when Marcus used the phrase Code Red, it meant the very survival of their mission was at stake. "I'll be there in 15 minutes with the legal team," Sarah replied, her voice taking on the steel edge that had made her one of the most respected physicians in the state. "Marcus, how bad is it?" The question hung in the air between them, loaded with years of shared commitment to the principle that healthcare should heal, not harm, based on prejudice. As Marcus ended the call, an elderly black woman who had been struggling with her walker near the clinic entrance approached him hesitantly. Her name tag identified her as Mrs. Dorothy Jefferson, and when she spoke, her voice carried the tremor of someone who had lived through decades of medical discrimination. "Excuse me, son," she said softly. "I couldn't help but overhear you mention Dr. Rodriguez. Isn't she the chief medical officer of Williams Medical Group?" The hope in her voice was heartbreaking, as if she was grasping for confirmation that the healthcare system might actually have leaders who cared about people like her. Marcus nodded, and Mrs. Jefferson's eyes filled with tears. "Dr. Williams saved my grandson's life last year when no other clinic would see him because we didn't have good insurance. He set up a payment plan that we could actually afford, and he made sure Jerome got the surgery he needed. Is Dr. Williams really going to fix what's happening in there?" She gestured toward the clinic where Marcus had just been systematically dehumanized, and he realized that this woman represented thousands of patients who depended on his organization to be different, to be better, to be the sanctuary from medical discrimination that he had promised it would be. "Mrs. Jefferson," Marcus said gently, "Dr. Williams is going to make sure this never happens again." The truth of his identity hung between them like a secret that would soon reshape everything. But for now, he was content to be seen as someone who believed in the mission rather than the man who had created it. When Marcus re-entered the clinic, Stephanie Chen looked up with barely concealed irritation, as if his return was a personal affront to her carefully managed schedule. "I thought you left," she said, her tone suggesting that his departure would have been the preferred outcome. "Do you need something else, or are you ready to settle your bill?" The assumption that he couldn't afford to pay for the substandard care he had received was the final straw in a haystack of humiliation that was about to ignite into a firestorm of accountability. "Actually," Marcus said, his voice carrying a calm that belied the revolution he was about to unleash, "I'd like to file a formal complaint about the quality of care I received today." The words were simple, professional, reasonable, but they carried the weight of a man who had built his entire career on the principle that every patient deserved dignity, and who was about to prove that principle was worth fighting for, even when the fight was against his own organization. Right at that moment, the glass doors of Prestige Health Center burst open with the force of divine intervention, and Dr. Sarah Rodriguez strode into the lobby, flanked by 2 corporate attorneys and a medical ethics specialist, her presence commanding immediate attention from every person in the waiting room. Sarah Rodriguez wasn't just any chief medical officer. She was a legend in healthcare circles, a woman who had testified before Congress about medical equity and whose face graced the promotional materials of every Williams Medical Group clinic. The moment Stephanie Chen recognized her, the color drained from her face like water flowing out of a broken dam, and she fumbled with her computer mouse as if trying to delete evidence of something terrible. Dr. Rodriguez moved with the precision of a surgeon and the authority of someone who had spent 15 years building ethical healthcare systems alongside Marcus Williams. Her sharp eyes swept the lobby, taking in the segregated seating areas where well-dressed patients sipped sparkling water, while others sat in basic chairs. The obvious disparity in treatment that had somehow become normalized in this flagship location. When her gaze landed on Marcus, standing calmly near the reception desk in his faded jeans and worn sneakers, something shifted in her expression from professional concern to barely controlled fury. "Dr. Williams," she said, her voice carrying across the now silent lobby with the weight of 15 years of shared mission and mutual respect, "I came as soon as you called." The words fell into the marble-floored space like stones dropping into still water, creating ripples of shock that spread to every corner of the waiting room. Stephanie Chen's mouth opened and closed like a fish gasping for air, her brain struggling to process what she was hearing. Dr. Williams, the Dr. Williams, the man whose name was carved into the marble wall behind her desk, whose vision statement about healthcare equity was printed on every piece of literature in the clinic, whose life story of rising from poverty to medical leadership was featured in the employee handbook she had been given on her first day of work. Dr. Hartwell, who had emerged from the treatment area when she heard the commotion, froze in the doorway like a deer caught in headlights. Her white coat, which had seemed so authoritative just minutes before, now looked like a costume she was wearing to play a role she had never been qualified for. The prescription pad in her hand trembled as the magnitude of what had just been revealed sank into her consciousness. She had just provided substandard care to the founder and CEO of Williams Medical Group, the man whose mother's story was told at every new employee orientation as an example of why their organization existed to serve all patients with dignity and respect. "But that's impossible," Stephanie stammered, her voice barely above a whisper. "He had basic insurance. He didn't look like—" She stopped herself, but the damage was done. The incomplete sentence hung in the air like a confession, revealing the ugly truth that she had made medical judgments based on appearance rather than need, that she had allowed prejudice to override the fundamental principles of healthcare that Marcus had built his empire to protect.
Dr. Rodriguez stepped forward, her voice taking on the authoritative tone that had made her one of the most respected medical leaders in the country. "This is Dr. Marcus Williams, founder and CEO of Williams Medical Group, the man who has dedicated his life to ensuring that healthcare is a human right, not a privilege based on the color of your skin or the size of your bank account." Each word landed like a hammer blow, driving home the devastating reality that the staff had violated every principle their organization stood for. He came here today under his employee insurance plan to experience care as a regular patient, and what he found was a betrayal of everything this organization was built to represent. The corporate legal team began pulling out tablets and notebooks, their movements efficient and practiced as they prepared to document what was clearly going to be a comprehensive investigation. One of the attorneys approached Stephanie's desk and quietly asked for access to the appointment scheduling system, while another began reviewing patient files to identify patterns of discriminatory care. The medical ethics specialist moved toward Dr. Hartwell, his expression grave, as he prepared to discuss the professional standards that had apparently been abandoned in favor of profit-driven patient sorting. Marcus watched this unfold with the calm of a man who had finally seen his worst fears confirmed, but was prepared to act decisively to address them. "Dr. Rodriguez," he said, his voice carrying the quiet authority that had built a medical empire, "I need you to review the appointment logs for the past 6 months.
Compare service times, treatment protocols, and care recommendations based on insurance types and patient demographics. I want to know how deep this problem goes." Sarah nodded grimly, already knowing that what they were going to find would shake the foundation of everything they had worked to build. Nurse Patricia Mills, who had been watching from the doorway to the treatment area, suddenly understood that her rushed, dismissive treatment of Marcus hadn't just been poor customer service, it had been a violation of medical ethics that could end her career. The clipboard in her hands clattered to the floor as she realized that every shortcut she had taken, every assumption she had made, every time she had provided different levels of care based on a patient's appearance or insurance, had just been exposed to the very person who had the power to hold her accountable for betraying the trust patients placed in healthcare providers.
No one expected what would happen next, but the digital evidence that Marcus's legal team uncovered in the following minutes would expose a level of systematic medical discrimination so deeply embedded in the clinic's operations that it threatened to destroy everything he had spent his life building. Dr. Rodriguez moved to Stephanie's computer terminal with the efficiency of a surgeon, her fingers flying across the keyboard as she pulled up appointment schedules, patient records, and treatment protocols that painted a devastating picture of institutionalized healthcare bias. The data revealed what Marcus had suspected but hoped he would never find: a two-tier medical system operating under his own roof, where the quality of care patients received depended entirely on their perceived ability to pay. "Marcus," Dr. Rodriguez said, her voice tight with controlled anger as she scrolled through months of appointment data, "the average appointment time for patients with premium insurance is 47 minutes. For basic insurance holders, it's 11 minutes. The numbers hit the lobby like physical blows, quantifying the discrimination that had been hidden behind professional smiles and medical terminology. But it gets worse. Dr. Hartwell has been systematically denying covered services to basic insurance patients, telling them procedures aren't appropriate for their coverage level when the insurance clearly authorizes the care." Dr. Hartwell, who had been standing frozen near the treatment area doorway, finally found her voice, though it came out as a desperate whisper. "We were trying to manage costs," she said, her words tumbling over each other in a rush to explain the inexplicable. "The clinic needs to remain profitable, and some patients just require more resources than others. We were being efficient with our time and focusing on patients who could afford our full range of services." The words revealed the ugly truth that she had transformed medicine from a healing profession into a business where human worth was measured by insurance coverage and bank account balances. Marcus stepped forward, his voice carrying the weight of 25 years of fighting for healthcare equality and the fresh pain of experiencing discrimination in his own organization. "Dr. Hartwell," he said, each word deliberate and measured, "you took an oath to do no harm. But denying preventive care to patients based on their insurance status isn't just harm. It's potentially deadly. You've violated everything this organization stands for, and more importantly, you've betrayed the trust that patients placed in you to provide competent, unbiased medical care." The corporate attorney who had been reviewing patient files looked up from his tablet with an expression of professional horror. "Dr. Williams, we've identified at least 47 cases in the past 6 months where patients with basic insurance were denied services that were clearly covered by their plans. Some of these patients were told to seek care elsewhere, while others were given substandard treatment protocols that don't meet basic medical standards." Each case represented a human being who had trusted the Williams Medical Group to provide ethical health care and had instead received discrimination disguised as medical judgment.
Stephanie Chen, whose hands were now visibly shaking as she realized the magnitude of what had been uncovered, attempted one final defense of the indefensible. "We were following Dr. Hartwell's instructions," she said, her voice breaking. "She told us that we needed to prioritize profitable patients and manage our resources efficiently. She said it was better for the business if we focused on clients who could afford premium services and moved basic insurance patients through the system quickly." The admission revealed that the discrimination wasn't accidental or unconscious. It was deliberate policy implemented at the management level and enforced throughout the staff. Dr. Rodriguez pulled up another screen that showed the clinic's patient satisfaction scores, and the data told a story that made Marcus's heart break. Satisfaction scores for white patients with premium insurance, 94%. Satisfaction scores for Black and Hispanic patients with basic insurance, 37%. The numbers represented more than statistics. They represented human beings who had left the clinic feeling devalued, dismissed, and betrayed by a healthcare system that was supposed to heal without regard to race or economic status. Marcus thought of his mother, Dorothy Williams, who had died because she couldn't afford insulin, and realized that Dr. Hartwell's discriminatory practices were a continuation of the same medical apartheid that had killed her. "Dr. Hartwell," he said, his voice steady despite the emotion threatening to overwhelm him, "your medical license will be reported to the state board for discriminatory practices that violate both medical ethics and civil rights law. Healthcare discrimination isn't just unprofessional, it's illegal, and it has consequences that extend far beyond this clinic." Dr. Hartwell's composure finally cracked completely as the reality of her situation sank in. "You can't destroy my career over this," she pleaded, tears streaming down her face. "I have a family, student loans, a reputation I've spent 15 years building. I was just trying to keep the clinic profitable. I never meant for it to go this far." Her desperation was palpable, but Marcus had seen too much suffering caused by medical discrimination to be moved by the tears of someone who had caused that suffering. "You didn't just compromise profitability," Marcus replied, his voice carrying the moral authority of someone who had dedicated his life to fighting the very discrimination she had perpetrated. "You compromised patient care, violated medical ethics, and betrayed the trust that vulnerable people placed in this institution. Your actions could have cost lives, and they definitely caused harm to patients who deserved better from the healthcare system they trusted to protect them." Nurse Patricia Mills, who had been listening to the systematic exposure of the clinic's discriminatory practices, stepped forward with tears in her eyes. "Dr. Williams," she said, her voice barely audible, "I want you to know that not all of us agreed with what was happening here. Some of us tried to provide good care to all patients, but Dr. Hartwell made it clear that our job performance would be evaluated based on how efficiently we processed basic insurance patients and how well we treated premium clients." The admission revealed that the discrimination had created a toxic work environment where healthcare professionals were forced to choose between their medical ethics and their job security, a choice that no healthcare worker should ever have to make. Marcus realized that cleaning up this mess would require more than just firing the perpetrators. It would require rebuilding the entire culture of the clinic from the ground up, ensuring that every employee understood that discriminatory care was not just wrong, but completely unacceptable in any organization that bore his name. As the legal team continued documenting the evidence and Dr. Rodriguez worked to identify every patient who had been harmed by the discriminatory practices, Marcus prepared to deliver justice that would send a clear message throughout his entire organization that healthcare discrimination would never be tolerated, no matter who was responsible or how profitable it might seem in the short term.
Right at that moment, Marcus Williams stood at the crossroads between justice and mercy, knowing that his next words would not only determine the fate of the people who had betrayed his mission, but would also send a message that would echo through every clinic in his organization for generations to come.
The weight of his mother's memory pressed against his chest as he prepared to deliver consequences that were proportionate to the harm that had been done, understanding that true healing could only begin when accountability was swift, decisive, and uncompromising. "Dr. Jennifer Hartwell," Marcus said, his voice carrying the authority of someone who had built a medical empire on the principle that healthcare should heal rather than harm, "your employment with Williams Medical Group is terminated immediately. Your systematic discrimination against patients based on race and insurance status violates not only our organizational values but also medical ethics and federal civil rights law." The words fell into the clinic lobby with the finality of a judge delivering a sentence, and Dr. Hartwell's face crumpled as she realized that her 15-year medical career had just been destroyed by her own prejudice and greed. Dr. Hartwell's legs buckled slightly, and she gripped the doorframe for support as the magnitude of what was happening crashed over her like a tsunami. "Please," she whispered, her voice breaking with desperation, "I have 2 children in college, a mortgage, and medical school loans that will take me 20 years to pay off. I know I made mistakes, but please don't destroy my entire life over this." Her plea was heartbreaking in its raw human vulnerability, but Marcus had seen too many patients suffer from medical discrimination to allow personal circumstances to override the need for accountability. "Dr. Hartwell," Marcus replied, his voice gentle but unwavering, "you had the power to provide life-saving care to vulnerable patients, and you chose to use that power to discriminate against them based on their appearance and insurance status. Those choices had consequences for the patients you harmed, and now they have consequences for you. Healthcare discrimination isn't a mystique, it's a choice, and choices have outcomes." The moral clarity in his voice left no room for negotiation or plea bargaining. Dr. Rodriguez stepped forward with a tablet in her hands, her expression grave as she addressed the assembled staff. "The State Medical Board will be receiving a formal complaint about Dr. Hartwell's discriminatory practices, along with documentation of every case where patients were denied appropriate care based on non-medical factors. Additionally, the Department of Health and Human Services will be notified of potential civil rights violations that may require federal investigation." The announcement sent a visible shockwave through the remaining staff members, who suddenly understood that this wasn't just an internal disciplinary matter, but a legal reckoning that could have far-reaching consequences. Marcus turned his attention to Stephanie Chen, whose hands were still trembling as she clutched the edge of her desk like a lifeline. "Stephanie, your employment is also terminated immediately for implementing and enforcing discriminatory policies that violated patients' rights to equal medical care. You turned healthcare into a privilege based on appearance rather than a human right based on need." Stephanie's composure finally shattered completely, and she began sobbing as she realized that her career in healthcare administration was over, destroyed by her willingness to judge patients by their clothes and insurance cards rather than their humanity. But Marcus wasn't finished delivering justice. "Nurse Patricia Mills," he said, turning to the woman who had rushed through his intake and dismissed his medical concerns based on his insurance status, "you're also terminated for providing substandard care to patients based on discriminatory criteria. Healthcare professionals have a duty to provide competent care to all patients, regardless of their ability to pay or their appearance." Patricia nodded through her tears, understanding that she had violated the most basic principles of nursing ethics and that her career was paying the price for her prejudice.
The transformation that followed was swift and comprehensive. Dr. Rodriguez immediately implemented emergency protocols to ensure that every patient who had been discriminated against would receive follow-up care at no charge, understanding that some of the medical neglect they had experienced could have serious long-term health consequences.
"We're establishing a patient advocacy program," she announced to the remaining staff, "with a hotline for reporting any instance of unequal treatment. We're also implementing real-time monitoring of appointment times, treatment protocols, and patient satisfaction scores to ensure that discrimination can never again hide behind professional facades." Marcus addressed the staff members who remained, his voice carrying both the weight of disappointment and the promise of redemption. "What happened here today represents a betrayal of everything this organization was built to achieve, but it also represents an opportunity for renewal and recommitment to our founding principles. Every one of you will participate in comprehensive bias training, not as punishment, but as education. You'll learn to recognize unconscious prejudice and to provide care that honors the dignity of every human being who walks through our doors." The ripple effects of the day's events began immediately. Mrs. Dorothy Jefferson, the elderly woman who had approached Marcus outside the clinic, was invited back for a comprehensive medical evaluation that addressed all of her health care needs with the dignity and respect she deserved. The legal team began contacting every patient who had been discriminated against, offering free follow-up care and compensation for the substandard treatment they had received. 6 months later, the Prestige Health Center had been transformed into a model of equitable healthcare delivery. Patient satisfaction scores had risen dramatically across all demographic groups, and the clinic had become a training site for medical professionals learning to provide bias-free care. Dr. Williams' annual physical was finally completed properly, with comprehensive preventive care that honored both his medical needs and his human dignity. The story became a case study in medical ethics journals and a turning point in the fight against healthcare discrimination. Marcus had proven that accountability wasn't just about punishment. It was about creating systems that protected vulnerable patients and ensuring that the promise of equal healthcare became a reality rather than just a mission statement on a marble wall. Most importantly, Marcus had kept the promise he made to his dying mother 25 years earlier, ensuring that other families wouldn't suffer the medical abandonment that had cost Dorothy Williams her life, and that healthcare would finally become what it was always meant to be: a human right that healed without regard to the color of your skin or the balance in your bank account. As Dr. Marcus Williams walked out of his transformed clinic 6 months later, finally receiving the comprehensive care he had been denied, he carried with him more than just a clean bill of health. He carried the knowledge that sometimes the most powerful medicine is the courage to confront injustice, even when it exists in the institutions we've built with our own hands. The truth is, medical discrimination isn't just a statistic in a research paper or a policy debate in boardrooms. It's a daily reality that affects millions of Americans who walk into healthcare facilities hoping for healing, but instead face judgment based on their appearance, their insurance card, or the color of their skin. What Marcus discovered in his own clinic reveals a heartbreaking truth about our healthcare system: that bias doesn't just hurt feelings, it costs lives. When healthcare professionals make assumptions about who deserves comprehensive care based on superficial factors, they're not just providing bad customer service. They're violating the sacred trust that patients place in the medical profession to heal without prejudice. The 11-minute appointments, the denied preventative screenings, the dismissive attitudes, these aren't minor inconveniences. They're barriers to life-saving care that can turn treatable conditions into death sentences. But here's what gives me hope about Marcus's story. It proves that change is possible when leaders have the courage to acknowledge uncomfortable truths and take decisive action to address them. The transformation of the Prestige Health Center didn't happen because of policies written in boardrooms. It happened because one man was willing to experience his own system as a vulnerable patient and then use his power to ensure that vulnerability would be met with compassion rather than discrimination. The lesson here goes far beyond healthcare. In every industry, in every organization, there are systems that claim to serve everyone equally, but actually create invisible hierarchies based on bias and assumption. Whether it's a bank that treats customers differently based on their clothes, a school that provides unequal education based on students' backgrounds, or a workplace that promotes certain employees while overlooking equally qualified others, the pattern is the same. Those with power must be willing to experience their own systems from the perspective of the powerless if they want to create genuine equity. Marcus's mother, Dorothy Williams, died not because diabetes was incurable, but because a healthcare system decided her life wasn't worth the cost of insulin. Her death became the driving force behind a medical empire that promised healthcare without barriers. But even that promise required constant vigilance to prevent it from becoming an empty slogan on a marble wall. The real tribute to Dorothy's memory wasn't the clinics that bore her son's name. It was the commitment to ensure that no other mother would die from treatable illness simply because she couldn't afford to look like she belonged in a doctor's office. If this story resonates with you, if you've ever felt invisible in a place where you deserved respect, or if you believe that healthcare should heal rather than harm, then I need you to do something powerful right now. Hit that like button to show that stories about justice and dignity matter to you. Share this video with someone who needs to hear that their worth isn't determined by their insurance card or their appearance. It's determined by their humanity. Subscribe to our channel and ring that notification bell because we're committed to bringing you more stories that expose injustice and celebrate the courage it takes to create meaningful change. Drop a comment telling us about a time when you experienced discrimination in a healthcare setting, because your voice matters, and together we can demand better. The fight for equal healthcare isn't over. It's just beginning, and it needs voices like yours to ensure that the promise of healing reaches everyone who needs it, regardless of who they are or what they look like when they walk through those clinic doors, seeking nothing more than the care that every human being deserves.